How do you treat a blood blister? Have you ever experienced a blood blister? These can be quite uncomfortable and are often caused by trauma or pinching that damages small blood vessels. Knowing how to treat a blood blister is essential, especially in survival situations where medical help may not be readily available. Let's break down the steps you can take to treat a blood blister effectively. First, clean the area. Begin by washing your hands thoroughly to prevent any germs from entering the blister. Then, gently clean the blister and the surrounding skin with soap and water, or use an antiseptic wipe. This step helps reduce the risk of infection. Next, decide whether to drain the blister. If the blood blister is small and not causing much pain, it is usually best to leave it intact. The blister acts as a natural barrier, protecting the underlying skin from infection. However, if the blister is large, painful, or located in a spot where it might burst on its own, draining it can relieve pressure and pain. If you determine that the blister needs draining, make sure to sterilize a sharp needle or pin first. You can do this by heating it in a flame or soaking it in alcohol. Once sterilized, gently pierce the blister at the edge or bottom to allow the fluid to drain out slowly. Be careful not to remove the overlying skin, as it protects the new skin underneath. After draining the blister, apply an antibiotic ointment to the area to help prevent infection. Cover the blister with a sterile dressing, such as gauze or a hydrocolloid bandage. If you are using gauze, secure it with tape but avoid sticking the dressing directly to the wound. To protect the area further, especially if the blister is on your foot, consider using moleskin with a donut cutout around the blister. This will help reduce friction and pressure. You can cover this with additional tape or bandage layers to keep it secure. It is also important to monitor the blister for signs of infection. Look out for increased redness, swelling, warmth, pus, or worsening pain. If you notice any of these symptoms, seek medical help if possible. In addition to these steps, keep the blister clean and dry as much as you can. Change dressings regularly to maintain hygiene. Avoid popping blisters prematurely, as this can increase the risk of infection. Control friction by wearing proper footwear and using protective padding. Antiseptics like iodine or alcohol can be used carefully, as they may sting but help reduce germs. By managing a blood blister effectively, you can continue your activities, whether hiking or working, without worsening the injury. The key is to balance protection, cleanliness, and minimizing further trauma to the area.